Okay, welcome to IT Band Syndrome presentation. We will have Dr. Samantha as our speaker on IT Band Syndrome. So I know this has been a topic for a little while, and I noticed some residents didn't really even know what the IT band is. And so Dr. Samantha here will give us the what is, the causes, the rehabs or things that you can do or should do if you're having these kind of pains and symptoms. So let's give a little hand for Dr.
That's very lovely. I don't usually give a hand for myself when I present on my own. It's very nice. Well, yes, we are here to talk about the IT band today. Raise your hand if you know what your IT band is. Great. Does anybody want to give me a guess as to where it's located?
I have some this going on.
Well, I see some correct answers. But I also see a lot of blank stares, and that is not abnormal. So let's dive into it a little bit. So what is it? All right. Well, first of all, your IT band. We'll skip to the second point, but it's really a thick band of fascia. So it's not a muscle. It's not a tendon. It's not a ligament. It's fascia. And basically, it comes from the top of your hip, your iliac crest. I'm going to go a little bit in depth, so just, nod and, yeah. So from your iliac crest, it's coming down because it's merging with fascias from the tensor fascia lata and the glutes. And it runs down the outside of your leg, pretty much right below where your knee is. It's a really nice, thick band, and it starts developing as an infant. That's what's helping give your body some support and stability through crawling, through kneeling, through, furniture surfing when you're a little tot, and then it gets stronger the more that you're using those legs. The syndrome itself is really more of an overuse condition. Overuse is a word I will qualify a little bit more. But typically the presentation for it would be a lot of pain or burning sensation right on the outside of the knee. So not on the inside, not on the front, really on the outside of the knee, even up into that outer thigh area as well. And it's usually derived from poor movement patterns as well as excessive tension on this supportive structure. And something that honestly not a lot of people know is that this fascia is really helping to stabilize the pelvis and the knee through flexion and extension, like what I'm doing now. But also what gets missed a lot is that with pivoting, it's actually providing a little bit of support and stability as well. That part gets missed by people often. But it's really, really important for that support, the stabilization, and it's transmitting forces from your glutes back here and your tensor fascia lata, TFL, that's up here, through the lateral thigh and the lower leg. So it really is important, but it's also really easily able to be inflamed. And by too tight, we're not necessarily talking about the IT band itself. Again, it's a fascia, it's not a muscle, but it lays right atop the vastus lateralis, which is one of your quadricep muscles. And like I said, it's connecting from these two big groups right here. So if those are tight, you're gonna have some changes in the tightness or the angle of the IT band as well. Perfect. So again, just to give more of a visual, I'm a visual learner, okay? So we've got your tensor fascia lata here, like I said, coming from the hip bone. You've got the glutes, especially like right on this angle, you see more of that glute max coming in. So you're seeing the combination of these fascias, and it runs all the way down just below where you see that red dot, okay? Right down here at Gertie's tubercle. And that area of redness, that's usually where that pain is felt. The reason being, you've got a bursa, which is a fluid-filled sac right underneath where that fascia is lying. And then on top of that, you've got some bony prominences from the knee joint, and it gets really, really kind of tight through that area. So again, if you have excessive friction and rubbing due to poor mechanics, the knee kind of coming in a little bit and doing those mechanics over and over and over, it's very easy to develop inflammation in that area. Okay, so who do I usually see this in? I've treated a lot of IT band syndrome. It is usually more so, I've treated it more in an active, very active population. Runners, cyclers, power lifters as well. Any activity that you participate in that causes a lot of this motion, the bending and straightening of the knee, you're more prone to. But I also see it a lot in very, very young people and even the older population, because that's usually when we are initiating a new workout regimen, a new exercise class, something like that. And if you are not properly getting the body warmed up, if you have underlying poor mechanics of your pelvis that's causing some angles through the leg, you're more likely to get IT band syndrome. But again, burning, sharpness, that's usually how it's described. People usually feel it the most when they are running, and that's because the IT band has the most contact with those structures we looked at when it's at about 30 degrees of knee flexion. So as you're striking, you can feel that, as well as when you're going downstairs or walking downhill, anything where you're going to be in that about 30-degree knee flexion range. Some people do feel a snapping. I'd say I've only seen that a couple of times. It's not as common. And you can have swelling. Because again, it depends what structures are inflamed, what structures are aggravated. That bursa, that fluid-filled sag, you've got tons of bursas all throughout your body. They're known for causing swelling. So you can see more of that if the bursa is involved. You can see it with that too. But the good news is that it usually can be fully successfully resolved via conservative intervention. So this isn't something I've really ever had a patient come in and need surgery for that I recall, and I don't think Sam's had anyone either. I would remember, because that would be a little odd. So that's the good news about some conditions like this, is that it really responds very well to a couple of different conservative treatments, which we will go over next. Or next. This is just to give you a little bit of like a demonstration. If you have like bowing of the legs, sometimes like different leg lengths, which can come from a dysfunction at the pelvis, or you can be born with one leg longer than the other. That does happen. That changes the structure of everything here down. So that can put you at a predisposition to develop IT band syndrome. In terms of the pelvis tilting, if you see someone with an anterior pelvic tilt, which is kind of excessive lordosis here, hip flexion here, you're at more of a risk of having IT band syndrome. Improper training, poor biomechanics, same thing. It's all about the pelvis and the core. All about the pelvis and the core. Muscle imbalances, which I will tell you, I don't know if I've ever had a patient here at Mason Point who has had really, really strong hips out here. That is the biggest muscle that can contribute to changing the angle of the lower legs, therefore putting more strain, a little bit more closeness to the IT band. So those abductors, which are right here, glute medius, that is one of the biggest things I've seen. And a sedentary lifestyle is not helpful. Like I said, this often comes from runners, cyclers, etc., but it's not uncommon to happen in people that sit, because when you sit for prolonged periods, what's happening is the glutes are becoming over-lengthened, which means they can't be so strong. And your hip flexors and some of the musculature through here is becoming too tight. And that's causing some changes in the angles. Biomechanically, it's not the greatest for you for lots of reasons. That's just one. So you do have to address it in many different ways. Usually, in order to find out what might be causing your IT band syndrome, you probably need a little bit more of an intensive evaluation. You don't want to just try and spend 2 hours every day addressing each one of these, just in case that's what your problem is. It's really better to hone in on the specifics so that you can attack it more individually. So treatments, activity modification is big. You will hear people use the word rest a lot. Rest, because this is an inflammatory condition. I'm not saying the Rice method is inappropriate. We do have some recent research kind of debunking the utility of the RICE method. But in this case specifically, what rest means is decreasing those painful activities like the repetitive walking downhill or walking downstairs or cycling or running, whatever activity you're participating in that falls in the list of like, we might not want to do that as much. Then try to decrease that and find other ways of being active to maintain your fitness, your cardiovascular health, etc., such as swimming or something, you know, that's not causing a bunch of this type of motion. So it doesn't mean do nothing, because again, what did I say about sitting? Not great, not great, not helpful. But for those athletic activities or daily activities that really, really hurt, yeah, try not to do that a lot. You can ice. In terms of stretching, you heard me talk about the TFL, that tensor fasciae lata. I've found a lot of people have restriction in that muscle that present with IT band syndrome. Another area that's not even on there, that vastus lateralis muscle that I talked about, I find a lot of people have trigger points through there as well, just because the IT band is really laying just smack dab on top of there. It can develop some irritation, some even a little bit of little pockets of excessive tightness. And the glutes, you know, we want to stretch them, but if you hop down, we also really need to strengthen the glutes. I don't need to go into a full anatomy lesson, but you have different glutes that do different things. We want to strengthen all of them, but particularly those abductors, that glute medius I was talking about, that is honestly, I've only had a couple patients that since I've been working that have had adequate strength in their hip abductors. Typically we don't maintain that stability in the pelvis well as we age, but even when I was working with young athletes, they had a lot of issues too. So it really can go across the lifespan. If you're just used to going forward and backwards, you're not developing those muscles. So that's something that needs to be integrated into your exercise regimen as well. Massage and foam rolling. I know Beth has a super cool class on foam rolling. That is a fabulous way to get, again, not necessarily the IT band, because that's a fascia that cannot be stretched, but those structures, those underlying structures, that tightness is only going to contribute to more of the problem. So that TFL, that vastus lateralis right along the IT band, all of that stuff is fabulous to use the foam roll, or I think I have it over here. In the gym, I know you guys all go there 5 times a week. If you cannot foam roll, because that does involve getting down on the floor, you can do your own kind of soft tissue work by just rolling across those muscles, rolling across the TFL. You can, I mean, you can use it for a while.
You can use a pinwheel too, right?
Yes, oh yeah. Yeah, this is just an example just because I was down there and I grabbed it, but you can do a ton of different things. You can have, you know, a lacrosse ball on the wall, just kind of roll across that. I mean, there's tons of different ways of getting to the crux of that. Also, if you're in physical therapy, manual therapy helps with that tremendously. And then at the end, I put anti-inflammatory medications if it's severe enough, if it's not, you know, base stage, if it's okay with your other medications, obviously check with your doctor first. But that could be something just to help with the general inflammation that you're experiencing. And I also wanted to talk about prevention. So you have to maintain your core and your leg strength and flexibility. It really is all about the posture of the, when we say posture, we're usually thinking upper body. The posture of your lower body from the trunk down is honestly just as, if not slightly more significant than upper body posture. And that's what that IT band is trying to contribute to. But if you've got, like I said, those lengthened glutes, those tight hip flexors, tightness through here, you're never going to be in a position to help that IT band get into where its happy spot is and decrease how much friction you can be causing down the line. Do not ignore if you're starting to have that outer knee pain, because it is a condition that if you catch it early, it's not going to be the biggest deal in the world. You have to put in some work, but You know, if you just let it build and build and build, we've gotten to the point that now it's snowballed into a huge inflammation problem, and that does take a bit longer to correct. So like I said, modifying your activity, contact your doctor, contact your physical therapist, contact your personal trainer. If you are finding things that align with this presentation, you know, in terms of what causes the pain, where the pain is, etc. And the reason being is, you know, research indicates when soft tissues, like the structures we're talking about, are irritated, and you keep doing the activities that irritate it, your body is not anywhere close to having the amount of ability to repair that area, to get the inflammation out. You just cannot do it, and you can develop chronic pain in that way. And that leads us to another probably hour-long presentation on chronic pain and neuroscience, but it makes it so much more difficult to resolve. So truly, if you start to have issues, you cannot ignore them. Do not ignore them. Yes, our bodies get older, and yes, sometimes a little bit more creakiness, aches, pains come with that process, but it really doesn't have to. And really, pain that affects your daily activities are not normal. So don't use it as an excuse not to seek help. Okay, then we've got just some examples. Again, consult with a healthcare practitioner for your specific needs, because just because I'm saying, hey, we need to stretch the lateral chain, we need to stretch through here, that doesn't mean that that's necessarily your problem if you have these symptoms. These are just like an example of what your treatment would be. So we've got a couple of stretches, we've got some good glute activation through here, some bridges, a prone quad stretch, which is just helping to stretch those structures like the vastus lateralis we talked about being really tight. We've got someone doing bird dogs right here in the middle. Like I said, core strength is imperative. Core does not just mean six-pack. Core means all of this, including the back, everything. So bird dogs, we've got someone down in that left-hand corner doing side steps with a band. That's to build up that glute medius muscle that I said was imperative. Same thing with the side lying hip abduction, and some hip hikes. Those are also for the glute medius as well. So like I said, it's a combination of stretching, it's a combination of strengthening, it's a combination of fixing your biomechanics and activity modification, resting actively. Again, I want to highlight that. Don't stop moving, but being smart about it, not trying to keep hammering in the inflammation. All right, that's a lot. Do you guys have any questions?
Oh gosh, I have so many.
That was so good.
I don't even know where to begin. But I do want to know, what is it right here on the back of your leg? Is that affected by the IT band as well?
That's your lateral hamstring, but
can that be affected by IT band?
It definitely has the possibility to be. I wouldn't say it's as common, but yeah, I mean, it's a structure on your lateral chain. The IT band is part of that lateral chain. It's not impossible that that's not being overcompensated for, you know, if you do have IT band issues, that your surrounding muscles aren't having to overcompensate and therefore causing maybe like a tendonitis-y type pain, or just another inappropriate overuse type dysfunction. I don't want to say injury, it's a little aggravating. But yes.
I have another question.
Go for it.
When you talked about tilting your pelvis, does that mean you're pushing your butt out, or yes, what does that mean?
So the kind of tilting, I mean, really a neutral positioning is best. So I'm not going to say this is the worst, but an anterior pelvic tilt, yes, please go for it. Yeah, so there's two types of pelvic tilting that really comes into play. Anterior pelvic tilting is when that fulcrum goes forward, usually being pulled by your hip flexors, the quads being tight. But in that process, it's also elongating through here. It's causing excessive tightness through here. And you can tell, here's my neutral position, here's anterior pelvic tilt, it's actually lengthening through the core as well. So your core is now become inhibited because it's being over lengthened, not at its appropriate contractile length. So it really affects a lot. It's very multifaceted for what it weakens, what it tightens, what's overstimulated, and what's understimulated. Yeah, it's a big issue. Posterior pelvic tilt is kind of like tucking the bottom in. That's not a great posture to sustain, but I do use it in core strengthening because it is good.
Because if you have an anterior tilt, you recommend, just squeezing your glutes more.
Yeah, you need more glute activation. You need a lot more lower core, so like transverse abdominis strengthening. But you also, your structures, depending on how long you've either been sedentary or how long you've been modifying your activities, like I said, if you're just sitting, my hip flexors are getting really tight. It doesn't matter how strong my glutes are, it doesn't matter how strong my core is. To correct out of that tilt, I still have to have the appropriate muscle length through those structures. So it really is, they have to both work together to make a more of a neutral, appropriate posture. Very multifaceted. Please.
How do you distinguish this from sciatic problems?
Oh, yeah, that's easy. Sciatic problems have a completely different distribution because of where the sciatic nerve innervates on the lower extremity. So usually you're not going to have pinpoint lateral knee pain with sciatica. You're usually going to have it down the posterior chain, anywhere from the lower back, down the back of the leg, even down to the foot, anywhere. You can have less than that, you can have more than that. But it's also what activities provoke that discomfort too. So if those bending activities are what provokes it, and it's right there in the lateral aspect, yeah, you're pointing more towards IT band syndrome. If it's not related to that, maybe it's activities where you're bending over constantly, or you're reaching, or even being upright a lot, that changes your diagnosis as well. So yeah, totally different, separate.
So pain, symptoms, pain behind the leg instead of on the side?
She's saying
the sciatic nerve typically presents down the posterior aspect, yeah, not right pinpoint on the lateral aspect of the knee. Anybody else? Oh yeah, go ahead.
What about the ligaments that cross the knee or whatever? Does it affect any of that?
The ligaments inside the knee?
Yeah. No. Okay.
No, those are doing other types of stabilization for the knee joint. So translational, some forward-backwards movement of the tibia on the femur, and vice versa. It's not going to affect that. It's just going to make all of your motion a lot more irritating. And if you're prone to like a lot of heavy inflammation, it can cause more generalized aches and pains through the knee as well, I guess. I wouldn't say that's impossible. But yeah, your ACL, PCL, all that good stuff.
What if you don't have those with a knee replacement, for instance?
Non-issue then, right? Can't affect them if they're not there, but...
Are you asking...
Well, because I have some pain, I have my knee replaced, but I have some pain if my knee's here, lateral across the front of the knee.
Like this? Oh, yeah. I don't know that that would necessarily be IT band syndrome, but I really couldn't rule it out without evaluating, if that makes sense. Anybody else? Please.
Do you ever have pain further up the leg?
You can. You can. It's, this is more the cause, but you can have effect of pain through here, not usually coming right from the IT band, but from the structures that are right under it. That vastus lateralis muscle gets those trigger points, can have some irritation. You definitely can if it's in a more aggravated state. Mm-hmm.
So what do you do if you've been sitting a long time and you're trying to get up?
Well, what do you do in what sense? What do you mean?
If you're sitting and reading for a long time,
then you get stiff.
Yeah, you get stiff.
To stand up?
Yeah.
I mean, scoot
Don't
forward.
sit so long, I know.
Well, yeah. That's always going to be the first answer that I like, but I mean, you know, if you're stiff, scoot forward in the chair, try moving that knee around a little bit, get a little bit of movement in before you really scoot forward, push yourself up. That's about it. That's all you can do. But, you know, get some movement in so that you're not stuck halfway up and you're like, ooh, that was a little too much, you know? Do a couple heel slides. Do just a little bit of movement through the leg. Hopefully that gets you a little bit less stiff so that when you do go to push up, easy peasy.
Sometimes I wake up at night and it feels like my bone's burning in my calf area.
In your calf?
Like your shin
This
bone?
bone right here. It feels like it's on fire.
Well, that's definitely not IT band syndrome.
Yeah.
Yeah, it could definitely, the perineals could be overactive. I mean, it could be nerve related as well. I've had a lot of people have nerve issues on that lateral aspect before. Could be coming from your lumbar spine. I mean, there's a lot of good possibilities there. But like I said, you've got a lot of modalities here that you can try first as like a first line of defense. Like I said, you've got that little rolly thing. You can use like I said, like a lacrosse ball and just put it on the leg, do circles with it to assess maybe it's overactive, maybe it's just like really, really tense. See if that doesn't relax it a little bit. Stretch those muscles out.
Is that on a day that you've noticed that you like walk a lot?
Not necessarily.
I would.
That's not restless leg syndrome, is it?
It really feels like it's burning. And it feels like it's on the bone rather than anything else.
Yeah, well, it's hard for your body to differentiate where you're feeling pain. So I know it feels like it's on the bone. It's probably on a structure that lays very closely. But you have a lot of nerves down in that area. And anytime someone says the word burning to me, I think more nerve-related pain. But like I said, that could be coming from any point. You know, all these nerves are coming from the low back. Doesn't mean it has to be a low back pain, right, associated with it. But, you know, going back to even sciatica, if you've got a sciatic nerve entrapment, you might only feel pain there down. You don't have to feel the whole way. Like I said, I would have to know more in order to give you more of a direct response, but not IT band syndrome. That's more nerve-related pain. I know burning, it can be used for both instances, but in that area, it's usually more nerve-related. Okay. But it could be from a tight muscle, too.
I was going to say, yeah, can your nerves...
You can have a
nerves
nerve
can
entrapment
have a
from time.
burn
Yeah,
from-
yep.
Yeah, your nerves can be tight.
Yeah, lots of different possibilities. The body's wonderful, but it's also very intricate.
Complicated.
Yes, it is very complex. That's why we still don't know everything about it yet, but we're working on it. Anybody else have any questions? Oh, please.
Yeah, so shots in your knees, if you're feeling discomfort, it might help, but it's not helping your IT band, is that correct?
Well, it depends where the source of the issue is. If the source of the issue is in the lateral knee, it also depends where they put the injection. I'm assuming you're talking about a cortisone injection.
Yes, yes.
That can help.
Your IT bands?
It's not about the IT band, it's about where the inflammation is. So if the inflammation's in the lateral aspect of your knee, depending where they put the injection, yeah, you can see a response to the cortisone injection. A positive response. But again, cortisone injections are not 100% successful, so take that with a grain of salt. There are just a lot of people or areas where it's like you never had it. But sometimes it's a lifesaver. You know, you just don't know. But yeah, again, I would definitely say it's not like a first line of defense, though. Just going and getting an injection. As soon as that cortisone wears off, if you still haven't made the appropriate biomechanical changes, you're going to go right back to square one. Yeah. Yeah. It's kind of the same thing I say about chiropractors. I love them, but if you're just going in and getting adjustments and you're not doing anything to change how much strength you have in those weak areas and stretch the tight areas, you're going to keep going back every week for your whole life. And if you want to, that's great. I would like to be pain-free and correct the issue. But that's me. Anybody else?
Is this ever bilateral or is it just on one side?
It's typically unilateral presentation. It's not common to have it bilaterally. It doesn't mean that it can't eventually happen on both sides, but typically when it presents, it'll be unilateral. If you have it bilaterally, there's probably something else going on. Anybody else? Questions, comments, concerns? All right, that is it. Thank you guys so much for coming. I appreciate it.
A lot of good information.
Oh, thank you. Thank you.